Regional Service Center. How can I help you? She is. Let me just transfer you over.
HARS is an AIDS service organization. We're one of about 35 in the province of Ontario. HARS has been in Kingston for 26 years, providing services to Eastern Ontario. We have prevention services, education and support around the issues of HIV and AIDS. Big focus really is about breaking down, still after 30 years of HIV, is breaking the stigma that goes with this disease for people who work with them, and then for those of us who are HIV positive, to make sure that we can live in our communities and live well in our communities.
We have the harm reduction. We do one-on-one counseling. If people have nowhere to live, is try to help with housing. Try and keep people from being evicted if there's problems where they are living. Making sure the medical care is good. So, you know, sometimes people are feeling, if they've gone to the clinic, that their needs aren't being addressed, so we can sort of act as liaison to help with those. We do a lot of liaisoning with other agencies to help people, whatever their needs are. We try and get people to appointments if they have no transportation, particularly people in the outskirts of Kingston, because we cover to almost Ottawa, to Belleville and up to Sharbot Lake. We have a dental program for people. If they need dentures, we try and help because they're not covered by anything. We have the pet program because we know how important pets are to people, so that supplying some food. And we also have a small fund that if somebody's animal gets really sick, we try and help with the vet bill if we can. So anything acute we try and deal with right away. And then any chronic issues we work away with people on to keep them connected.
Information is really key here. So there's an entire library of information based on health, sexuality, all that stuff. It's a safe space for mostly people who are homeless, who are not knowing where to turn, but also the LGBTQ umbrella, which stands for lesbian, gay, bisexual, transgender, queer. That whole umbrella attracts a lot of people in here. A lot of the homeless people also access our needle exchange services and just providing the free and safe ways to use drugs.
Hi, my name's Dana. I'm a student from Trillium College studying community service worker, and I've been placed here at HARS, HIV/AIDS Regional Services. And my duties here include doing the needle exchange, harm reduction. This is all our sterilized, unused equipment that we hand out. Clients are allowed to take whatever they need, whenever they need. Mostly what they ask for is the 1 cc syringe. Having liquid drugs, they would put it in the needle and then inject it into their arm. We also have half cc, so just a smaller version of this needle. We do have barrels as well, which are just without the tip. As you can see, they come in a pack of 5. We have 26 gauge, we have 23 and 22. And then we have water, sterilized water, as well as with spoons. There's a filter included in there. We also have crack pipes in here, glass pipes. For the client's convenience as well, we've put together crack kits. So it's everything that they need to smoke crack in kind of a handy package. So we also offer extra filters here. As you can see, they come in packs of 5 with lots in there. We offer ties. So this would be used to get a vein. So you'd put this around your arm, tighten it, and then a vein would come up wherever you're injecting, and that is where the needle would go in. And alcohol swabs are important as well. This keeps the area clean, safe injection site. So again, they're allowed to take as much as they need. Some people come in and take for friends or relatives, and that's fine. They're allowed to take unlimited supplies. We do keep track of it. It's all confidential, so we don't require any names. We just date it. We count how many needles, or ask the client approximately how many are coming in, if they do bring needles in. Needles out, we have types and tips. So basically what's gone out of the inventory. And it's for statistical reasons as well, to keep track of what's coming and going. So we do all this because harm reduction helps us contain Hep C, HIV, and it doesn't spread it.
When we have people come in and get supplies to use drugs, because we give out clean needles and crack kits, is that, you know, they come in regularly, and then eventually sometimes they get to trust us here because there's no judgment passed, and then they might come to us and say, you know what, I don't want to do this anymore. I'm tired. I don't want to do these drugs anymore. Can you help me get into detox? Can you help me get into rehab? And that's one of the reasons why we do it, is that people start to trust us. They come in, they know us, and when they've had enough, that's what they'll come to us and say, I need help. Can you help me? And that's one of the big payoffs, for sure.
When I was first diagnosed, I felt my whole life caved in around me. I was just full of dread. I was very ignorant of what HIV was all about. I was one of those people who thought it was a death sentence. You know, my life was over, you know, everything that I knew and accepted and all the people that I associated with, everything was gone. You know, I was that scared. You know, I didn't know what to do. And then I said, okay, well, you know, I can't crawl into a shell and just be nobody. So then I went out and I started to get the information. What was HIV? You know, what was going to happen to me? What was going to happen to my body? You know, how sick was I going to get? All these things that were out there at the time. This was going back 15 years in my case. Then I started to get knowledgeable. But when I think back, it was someone from HARS that came the day I was released and picked me up and brought me into the city. You know, this was the first place I came to when I was released. But that very first year, it was, the conference is called Opening Doors, but it also opened my heart. And it was one of those moments, I think everyone has one of those aha moments. That was mine when it comes to this organization. And I think that's where I finally realized, okay, I'm going to let my voice out. You know, it was that weekend that I said to myself, okay, you know, I've got these things, they're all back here in my head, you know, they're in my heart, it's time to let them out. So I asked, what can I do? This is what I'm capable of doing. These are my abilities. You know, can you help me? Or can I help you? And from there, they've kept me very busy. You know, they've asked me what I like to do. And one of the things that I like to do is carry a message. So that's what I've been able to do.
When someone comes in and sits with myself or another staff member, it's not about just looking at the person and their HIV, it's about looking at that person and looking at the HIV along with their dreams and their hopes, and then helping them make those dreams and hopes come true. So we spend time getting to know people. We take care of the urgent needs. If someone needs housing or medical care, you take care of that. If somebody can get housing and medical care, then we can start working on the small things. And I think that's what we work really hard on doing here, is who's ever coming through the front door, this is their place. It's not about what we want, it's about how do we work with you and leave judgment and stuff at the door. It's the whole person that's important.
John was my first contact, with HARS. But that was, like I say, in the early 90s. And it's just been an ongoing, relationship since then. The big thing is that they're there. You can pick up the phone and call them anytime about anything. So I've called HARS even if I'm just, having a real bad day in prison. I'm having a real bad day or something. I'm pissed off. Or if I need information, and I can't access the internet and don't have access to a computer, I can phone Diane or John or somebody here at HARS and say, okay, this is my problem and this is what I think and I need this information, and they will do that for me. Also, just to have a visit in prison, they come once a month or something and to see all their people, their guys, and that alone is kind of nice.
When I say prison, the first thing people often think about is the worst. Russell Williams, Paul Bernardo. When I say prisoners, that's what they think about. When those are just a minority, that the vast majority of people will be being released. They're not monsters. And I guess that was one of the big things I struggle with, is trying to get people to understand that. And that it's better for all of us. I would prefer people to come out of prison mentally and physically healthy, because they are going to be released anyway. So let's make sure they come out mentally well and physically well, because it bodes better for all of us, for them and for us as a society, as a community. It's better when people come out healthy.
I don't have that family kind of that a lot of people do. They fall back on their family, rely on their family for advice, support, love, that kind of thing. I get most of it right here at HARS. As I said, I have to pull myself back sometimes for looking at them too much like a family, But I think that's what they are in large part, at least for me.
What we are is like maybe an island of stability in some people's chaotic lives too. Because we do have people that live on the margins, that live in a lot of chaos. They're homeless or they're using, they live in poverty. And the one thing anyone that walks through our door knows is that they're going to be treated respectfully and with kindness, and that we will do whatever we can to sort of help them, whether it's just have a cup of coffee and a piece of toast, but they're safe here.
We celebrated our 25th anniversary. That's a long time for an organization to be around and still doing the work and growing. We continue to grow. A lot of places are going smaller, we're going bigger. It's very good, and it's something that I'm actually very proud of, that we're able to continue to add staff and add programs so that we can meet the needs of people that are coming through our door for service. And then, of course, our house in Belleville, to be the first place outside of the city of Toronto and outside of Ottawa to have HIV housing. We are working with Altogether Housing in Belleville and the Mental Health Organization. A house was donated, $350,000 worth of renovations was done, and we now have 3 apartments where people living with HIV are living. And that was probably our proudest moment, is to have this little dream a year ago about opening a house, and within a year it's opened and people are living in it.
There's going to be a mourning period when you're diagnosed. There's going to be denial when you're diagnosed. There's going to be anger when you're diagnosed. I think everyone goes through that. It's like having a death. When I come out the other side, what am I going to do? And my decision was, I'm not going to let this beat me down. And I think that's what people need to decide for themselves. You got a choice, You can sit down on your ass, or you can get up and you can kick ass. And I chose to kick ass.